Adrian, go over my individual report of DaVita. So DaVita is um, a healthcare company that's based in the U.S. They focus on people with kidney disease. They're the second largest in the U.S. with 37% market share. And they use analytics and predictive analytics to improve healthcare and make it more cost effective, which is why I would be interested in working for DaVita as a BIA major. So, think of on economic factors. So, they have a lot of healthcare regulations that they have to abide by. CMS is the Center for Medicare and Medicaid Services, and they basically they have a lot of regulations. They also make the rate for each service that DaVita provides, and so 90% of DaVita's patients uh, are served through CMS, which then has to reimburse DaVita, which is happens at a fixed rate, and it's much lower than the rate that private insurers, which are 10% of DaVita's uh, patients will pay. So economic downturns can reduce people's access to private insurers, which is where DaVita makes its real profit margins, because a lot of people get their insurance through their work. The health cost of healthcare services is increasing with the cost of like wages increasing for healthcare workers, but the industry is expected to grow, and so DaVita will have more patients soon. Um, so the US has an aging population, with 15% of all adults having chronic kidney disease, though many of them don't know it. But there is a large market in the US for DaVita, but they have a sort of a poor public perception for their fraudulent billings and some former past transgressions that I'll get into in the legal settings stuff. So um, they have some technological factors. They have at-home dialysis, which is a new device that allows patients to do dialysis at home. DaVita is working on that, and their use of machine learning and analytics to improve can and make it more personalized and cost efficient is changing the way they do business. So their environmental factors, each dialysis uses a lot of water. They also create a lot of medical waste, and they have a pretty large carbon footprint. So some legal factors. So DaVita has paid over $1 billion in settlements for in legal fees. They were caught in 2022. They conspired with competitors to avoid hiring former employees. In 2015, they overbilled Medicare for dialysis drugs and had to pay $450 million. 2018, they were found to have been paying doctors to refer patients to DaVita over care providers. In 2017, they were accused of negligently using unsafe treatments. Um, so now I'm going to go over some of the bargaining power, or some of the Porter's five forces. So DaVita is paid when it's reimbursed by insurance companies through Medicare and Medicaid, which means that all the rates are kind of like flat. So there isn't a ton of incentive for like financial incentive for a patient to choose to go to DaVita over one of its competitors. Um, and even the reimbursement rates can be from private insurers can be negotiated, and there are competitors as well. So DaVita has a really high threat. The industry has a really high bargaining power of buyers. The bargaining power of suppliers is also really high. The pharmaceutical companies that control the price of the drugs that DaVita needs to do dialysis, and also like the manufacturers for the like niche medical equipment. There are many of them, so they have a pretty high bargaining power as well. The threat of new entrants is pretty low because there are some really high barriers to entry, like the cost of opening a dialysis center can range from $1 to $3 million. The CMS regulations are very stringent, and the existing competitors have built a lot of trust with hospitals and doctors and patients alike. So there are a moderate threat of substitutes. The kidney transplants will eliminate the need for dialysis, but they're expensive and it takes like 3 to 5 years for most people to get one. Home dialysis is a growing industry, which eliminates the need to go to an actual clinic. Um, and DaVita's tapped into that. And then artificial organs could potentially one day like remove the need for dialysis, but not soon. So the rivalry among existing firms is really high because of the set price by the CMS. All of the firms have to compete on the same um, on quality of care, and since they're all competing in the same like area through differentiation, the competition is really is very fierce. DaVita is working on portable home dialysis devices for people who want dialysis on their own terms, and it'll improve their quality of life. This is like a complement to the Five Forces, and it's a growing industry. So um, here are the competitive advantages, like advantages that I've found. Strategic competitive advantages that I've found that DaVita has. So they have specialized care for their patients. It's rare, not not many care providers specialize on kidney disease. It's valuable because the patients with kidney disease really do need the care. It's costly to imitate, just because getting like this level of expertise and like all these care providers, all these this workforce together is really, really expensive. And it's organized to create value because it reaches a niche of people. And the brand image and established relationship with healthcare providers are both uh, uh, label because they help because they translate to more patients. They're rare. They're like really, obviously like they're intangible assets which are hard to get. They're and hard to imitate because they take a bunch of time to build, and they're organized to get value again because they translate into like referrals of patients, which is good for their business. So their business level strategy. So they use a differentiation strategy. They have to. So they focus on providing a higher level of care than their competitors, and their corporate level strategy. They're diversifying horizontally by like going into like the at-home divert and dialysis treatment devices. They're also expanding. They've expanded into 11 different countries geographically, and their horizontal integration. They buy a lot of smaller clinics to increase their market share and reduce competition. So my recommendations for DaVita would be firstly to integrate vertically. I think they need to get a control of their supply chain in order to reduce the costs of the drugs that they need to do the care. They also need to they also want to control some of the supply chain with like the equipment they use so that they can reduce the cost. They want to ease the bargaining power of suppliers. I think they should continue with analytics to make their care more personalized and unique and more effective to help them stand out because they have such a large market share and so much data to use. They can be better than a lot of their competitors at using their data. Um, they also need to um, like avoid their legal problems. They need to like abide by the rules because those all of their transgressions legally have like really, really hurt their brand image and their business, and that's like one of their competitive advantages, and it really sets them below their like their big competitors. Um, so those are my three recommendations for DaVita. Um, I would say continue to horizontally diversify with the at-home devices, vertically integrate to take control of their supply chain and reduce their costs, use their data, um, like continue to use their data and their large consumer base to their advantage, and like abide by the laws. So that's four. Um, cool. Thanks.